Can a business legally tell the patrons they have to be vaccinated or wear a mask when they're in their on their property?
Right. So it's been really interesting what's been happening in Arizona with Governor Ducey and a number of the executive orders that have come out. So, with that in mind, businesses that work with the state of Arizona that receive public funds, they are under a different, they may be restricted in ways that you wouldn't be if you were just a private business not contracted with government in any way. So technically, right now, private businesses not doing work directly with the state of Arizona, they can have a map, they can have a sign that they can hang outside their building that says no mask, no service. They can't require proof of vaccination. But I think while businesses are trying to navigate this space, it's important to also ask how would they um, how would they implement this policy, and also how would they enforce it? So would they apply the policy to anyone that comes through the door? Vaccinated and unvaccinated people both have to wear masks, or would they try to follow the CDC guidelines specifically, which only really recommend those who are unvaccinated to continue to wear a mask indoors? So it gets very tricky with then determining within how do you know if they've been vaccinated.
You mentioned the university, so you're referring to higher education and public funds. What's going to be the balance when we talk about K through 12 education? Can school districts that are publicly funded require students or even parents, for example, who are volunteering or teachers to wear a mask and or be vaccinated?
In terms of K through 12 and also healthcare institutions, they were not part of that recent executive order. So today, if you're in K through 12 education, you could still require proof of vaccination for the COVID-19 vaccine. And also, healthcare institutions are still following under a previous executive order that did allow them to ask for proof of vaccination.
Now, during the height of the pandemic, we saw the governor issue executive orders, and many people in some cases would say, that's fine, but I'm going to do what I want anyway. How much weight does an executive order actually carry?
These executive orders are very specific in some cases, like particularly the one that was issued on June 15th. And as a result, University of Arizona, for example, my employer was thinking about a policy that would require students to be vaccinated upon returning to campus, and they now are going to follow the executive order, which is very specifically detailed that if you are a public university in Arizona or community college, then you cannot make that requirement. So it carries a lot of weight. If I could highlight what's been happening nationwide with universities compared to what recently came about this week in Arizona, there's actually been a strong trend in universities across the country mandating COVID-19 vaccines, and not just for students, for staff and faculty as well. In fact, over 500 campuses now have mandates that require COVID-19 vaccination. And 200 of those are with public institutions. And so they really range from requiring everyone involved with campus life, the faculty, employees, and students, to have a vaccine. To some policies, 11 campuses to be exact, only require if students who live in dormitories or student housing to be vaccinated. So it's really quite an outlier what's recently unfolded in Arizona to not allow public universities to have any requirements regarding vaccination, proof of vaccination, testing requirements, mask usage. It really is out of sync with what's happening around the country.
At one point, Arizona actually led the nation in vaccines and then also in vaccinating rural Arizonans. The numbers, though, at this point seem to show that it could be skewing a different direction. What do you attribute that to?
Well, initially, there was to get vaccinated. Arizona also has an older population, and they've been trying to keep safe, staying at home, staying away from public places. So I think we saw those who wanted to get vaccinated got vaccinated right away. And now we have a lot of folks who are either in the wait and see group. They still want to, make sure that the vaccines are safe and effective, and then we also have those that just absolutely don't want to be vaccinated. But I think of those two groups, the larger is the wait and see, and that's why I think it's still important to keep up this public messaging that it's safe to have these vaccines. It's very effective. It's not just for you; it's also for your community. And if we don't do it, then we could see the numbers continue to increase with cases and deaths. So there is an impact there.
Professor Tara Sklar from the University of Arizona Rogers College of Law. Thank you.
Thank you.